Hello, my name is Dr. Michael Robinson, and our presentation today is titled Two Symptoms to Triage Acute Concussions, using decision tree modeling to predict prolonged recovery following concussion. While most people will recover quickly following a concussion, somewhere between 10 to 15% will remain symptomatic beyond 1 year. Patient stratification can help us inform the triage process and enable treatment centers to focus their scarce clinical resources to areas where they're likely to do the most good. When we identify high-risk patients early, we can prioritize their care, reduce their wait time, and rapidly mobilize rehabilitation services to help alter their treatment trajectory, optimize their potential for a good clinical outcome, and reduce the occurrence of persistent symptoms and decrease their secondary disability that may have resulted from it. The purpose of our study was to examine the 22 symptoms from the Sport Concussion Assessment Tool Symptom Evaluation using a decision tree analysis to identify the symptoms that are most likely to predict the development of persistent symptoms following a sport-related concussion. We built a decision tree using data from 273 patients who were initially assessed either by an emergency physician or a sport medicine physician within 14 days of injury. We performed this analysis using R, and we used the R packages rpart and carat to help build and assess the final decision tree. Of the 22 symptoms that comprise the Sport Concussion Assessment Tool Symptom Evaluation, only 2 were identified and were included in the final predictive model: feeling like in a fog and sadness. The post-hoc analysis of the model revealed that we had a statistically significant accuracy of 0.76, a sensitivity of 0.64, and a specificity of 0.88. Here we present the final prediction model. The model works left to right, starting with the symptom feeling like in a fog. Now, it should be noted that these symptoms are rated by the patient on a 7-point Likert scale from 0 to 6. So we see here if the patient reported a 0, 1, or 2, we would follow the top split. If they reported a 3, 4, 5, or 6 for feeling like in a fog, they would go directly to a 73% risk of prolonged recovery. When they go to the sadness node, it then splits into 2. It should be noted that the level of sadness number 4 was not included in the final model, as no patient had reported the level 4 within the data set we had. However, we can see here another logical ordinal split where if they have a low level of sadness, they would actually go into a 33% risk of prolonged recovery. But if they had a higher level of the item, 2, 3, 5, or 6, we would see an 83% increased risk of prolonged recovery. So this analysis yielded a statistically significant decision tree model, which then can be used by clinicians as part of a comprehensive clinical examination to identify patients at their initial presentation who are at higher risk of having persistent post-concussion symptoms lasting 28 days or more. We'd also like to acknowledge the contribution from the Ontario Brain Institute, who provided us with an additional data set obtained from emergency department settings in order to help increase the robustness of our model.